Here is a detailed explanation of pioglitazone, covering all aspects comprehensively. Number 1. Basic information. Generic name, pioglitazone. Drug class, thiazolidinediones, TZDs, also known as glitazones. Drug forms, oral tablets, 15 milligrams, 30 milligrams, 45 milligrams. Brand name Actos, most widely known and used, available as generic under the name pioglitazone hydrochloride. SNARB 2. Definition: pioglitazone is an oral antihyperglycemic agent that helps control blood sugar levels in individuals with type 2 diabetes mellitus. It is not an insulin, but works by increasing the body's sensitivity to insulin, which helps cells use glucose more effectively. 3. Mechanism of action. Pioglitazone selectively activates the peroxisome proliferator activated receptor gamma GAGWANG, a nuclear receptor that regulates the transcription of insulin-responsive genes. This activation results in improved insulin sensitivity in adipose tissue, skeletal muscle, and liver, increased glucose uptake by peripheral tissues, decreased hepatic glucose production, does not increase insulin secretion, so the risk of hypoglycemia is low unless used with insulin or sulfonylureas. Number 4. Uses pioglitazone is used for type 2 diabetes mellitus, T2DM, to improve glycemic control. Used alone or in combination with metformin, sulfonylureas, insulin. Open quote, note, it is not used to treat type 1 diabetes or diabetic ketoacidosis. Close quote. 5. Indications. As monotherapy or adjunct to diet and exercise to improve glycemic control in adults with type 2 diabetes mellitus, for patients who cannot tolerate metformin or require combination therapy for better glucose control. Number 6. Contraindications. Avoid using pioglitazone in the following conditions: NYCHA class 3 or 4 heart failure, severe hepatic impairment, history of bladder cancer or unexplained hematuria, pregnancy and lactation, diabetic ketoacidosis, known hypersensitivity to pioglitazone or any component of the formulation. Number 7. Before taking this medicine, precautions. Tell your doctor if you have heart problems, increases risk of congestive heart failure, liver disease, must monitor liver enzymes, bladder cancer, risk may be increased with long-term use, ocular problems, risk of macular edema, bone health issues, may increase risk of fractures. Polycystic ovary syndrome, PCOS, may induce ovulation and cause unintended pregnancy. How to 8. How to use. Take orally once daily. Can be taken with or without food. Swallow the tablet whole with a glass of water. Take the medication at the same time every day. Must be taken consistently. Blood sugar control takes several weeks. Number 9. Dosing information. Adults with type 2 diabetes, initial dose, 15 milligrams or 30 milligrams orally once daily. Start with 15 milligrams if using in combination with insulin. Maintenance dose. Adjust based on glycemic response. Dose can be increased to 45 milligrams once daily. Evaluate the response every 3 months. Maximum dose, 45 milligrams a day, open quote. Dosage adjustment not required in mild renal impairment, but caution in moderate to severe renal disease when used with other agents. Close quote. Now 10. Missed dose, overdose. Missed dose. Take it as soon as remembered. If it's close to the next dose, skip the missed dose. Do not double the dose to make up. Overdose symptoms. Low blood sugar, especially when used with insulin or sulfonylureas. Excessive fatigue, weakness, severe fluid retention or swelling. No specific antidote, manage supportively. Action, call emergency services or poison control. Till 11. When to stop or avoid taking. Stop pioglitazone immediately if signs of heart failure, shortness of breath, swelling in legs, weight gain, symptoms of liver damage, jaundice, dark urine, severe fatigue, blood in urine or signs of bladder cancer, severe allergic reaction, rash, itching, swelling, dizziness, or trouble breathing. Pregnancy is confirmed or suspected. Doc 12. Side effects in detail. Common side effects: weight gain, edema, especially of the hands, ankles, or feet, headache, muscle or back pain, upper respiratory tract infection, sinusitis. Serious side effects: heart failure, bladder cancer, risk may increase with long-term use, fractures, particularly in women, arms, hands, feet, macular edema, blurred or distorted vision, liver toxicity, must monitor AL to AST, hypoglycemia if combined with insulin sulfonylureas, ovulation induction may cause unplanned pregnancy in anovulatory women. Number 13. Vital information. Not for type 1 diabetes or diabetic ketoacidosis, requires regular liver function monitoring. risk of fluid retention and cardiac failure. Monitor especially in elderly and heart patients. Use cautiously in women. Higher risk of bone fracture. Can restore ovulation in women with PCOS. Discuss contraception. Number 14. Other drugs that will affect pioglitazone. Drugs that increase pioglitazone levels. Gemfibrozil, CYP2C8 inhibitor, can increase risk of side effects. Drugs that decrease pioglitazone levels, rifampin, CPC8 inducer, can reduce effectiveness. Other interactions, insulin or sulfonylureas, risk of hypoglycemia. Diuretics, NSAIDs, may worsen fluid retention or risk of heart failure. Oral contraceptives may decrease effectiveness. Open quote, always inform your healthcare provider of all medications, prescription, OTC supplements. Close quote. If you'd like, I can also provide Thank you. Have a nice day.